join us for a shockwave session. This is to free up my thoracolumbar junction. We have Bella here who's going to shockwave my back so you can see what the experience is like, okay? Yes. And then we'll start with the DX28T, the golden head. Perfect. Are you ready to start? Yes. So as you can see, one of the things that is really important is how shockwave is actually done on the body. So Bella's feeling where the tissue is restricted. I'm giving her feedback of where it's feeling good, where we feel like we're making progress, where we feel like the tissue needs to release or where the joint needs to release. So now she is moving on to what head? A6. The A6 head for our Quirimedics shockwave machine and radial pressure shockwave machine. And she's going to use A6 to free up my T10 through L1 facet joints. She's going to work her way into each of those facet joints. So watch her do that.
Are you good to start?
Yep. So what we were doing here is we were shockwaving my thoracolumbar junction to help me get a little bit more lumbar extension as I'm more locked up in those facet joints, not allowing me to fully get extension. That's where my initial injury happened. But we can really use this radial pressure shockwave along any injury point. And really the magic of making this stuff works comes down to the practitioner having an awareness to be able to find what's restricted and what's causing the restriction in your body that is creating this pain or the original injury site. So a lot of times it can also treat the compensatory places that are not necessarily the response, like the reason why you're having pain, but are giving you symptoms because of the compensation patterns. So, but we like to treat the root cause of what is causing the dysfunction and where the initial injury was to make the permanent changes in the cellular structure. And that's what radial pressure shockwave does, is it helps lay down new cells because of the little micro traumas that is created by these radial pressure sound waves. So I'm Dr. Allison Ferldt. Thanks for joining me. Let me know if you have questions, comment below.